Hi everyone, I'm Dr. Alyssa Watson.
And I'm Dr. Beth Molleson.
Thanks for joining us again in the Veterinary Breakroom. In the break room, Dr. Beth and I have short, informal conversations about relevant topics in veterinary medicine. And today we're taking a little stroll down memory lane. We're going to talk a little bit about some of the teachers that were influential when we were in vet school, and how that has kind of shaped what we love to do every day and sometimes kind of what we dislike in clinical practice. So, Dr. Beth, did you have a teacher that really influenced you when you were in school?
Yeah, Alyssa, when you first brought up this topic, it- I feel like for me in vet school, I mean, I guess the answer to your question is yes. There were there were certainly some professors that I feel like were super engaging and that really helped not only, their profession seem more fun. So, our cardiologist, for example, I feel like he found the joy in cardiology. And so that let us kind of see the joy in cardiology a little bit more. But I also feel like he was an effective teacher. And I feel like the fact that we were learning, we were able to learn some of those more difficult concepts in turn also made us like the subject for maybe more I don't know what the right adjective is, but just because we had a better grasp of the subject, that of course leaves you more inclined to have a good impression of that topic. But when you first asked this question, I feel like for me, when it comes to this, I feel like it was almost in my earlier days. So like when I was in grade school, I feel like that is when I really was most affected. I feel like when you're young, you're kind of a blank slate. And so your first impression, maybe to some degree, was really what affect like math. I remember I had a few good math teachers in a row that really that just were really enthusiastic and kind of left a good impression. And I feel like that lasted the rest of my life. But what about you, Alyssa? When you think about this topic, are there specific which subjects in vet school or I guess other schooling do you remember being impacted?
Yeah, I agree with you 100%. And definitely there is a ton of research out there about, the lasting impacts of really good teachers, especially like you said, in those formative years, when you're younger. I think just as a profession, we should be looking at that as a time to really get, kids excited about entering the field of veterinary medicine and what can we do in order to encourage, possibly some groups of students that wouldn't have been interested before to really grasp those dreams and know that they can, that this is something they can do moving forward. I think teachers are incredible about that. I had the most incredible teacher in 5th grade, now that you bring it up. Mr. McInerney, he was awesome. And he was one of those teachers that he loved teaching. He loved not only, imparting knowledge to us kids, but also like getting us into to become curious and to be critical thinkers and to find, the things in school that we were interested in so that we could, foster that curiosity and lifelong learning ourselves. And so yeah, I do think that starts very young. But then, going back to when I was in veterinary school, there were just a handful of teachers. My dermatology professor was one of them. He will forever be one of my favorite people in the whole world. And he really instilled this love of dermatology in me and I think most of the students in our class, because he was just that guy that
Mhm.
everybody loved, and he was passionate about teaching dermatology, and so that made all of us really excited about it. Sometimes I think the other can happen though too. I had a couple subjects where even now today, 20 years out, I shy away from a little bit because I didn't really connect with that professor. Do you have a subject like that?
Yes, the one I'm thinking of is It was a course on antimicrobials. I think it was like a pharmacy course and a course on antimicrobials. And I just really felt like it was presented to us in a rather convoluted manner. Like, just, so I almost feel like in those younger years, the teacher can bring the enthusiasm through just engaging with the students. I almost feel like in your older years, including vet school, the enthusiasm needs to come from a teacher who can effectively teach you the material, and then you get enthusiastic yourself, if that makes sense. When you're starting to understand the concepts, I feel like that is what brings the enthusiasm. And so, yes, getting back to your question, this antimicrobial class, I feel like it was just very disjointed. The concepts were not brought down to the level of where we were at. It was not very clinically relevant information. And that just really soured me on the whole thing, but particularly because I didn't feel like I was learning what I needed to. I don't feel like I took away any clinically relevant information. I feel like I left without a lot of, just a lot of hopes and prayers in that department, rather than, feeling like I had a solid foundation. And yeah, that kind of ruined it for me.
Yeah. For me, it was ophthalmology. I just didn't connect with the ophthalmology professor, and felt, kind of the same way, that I wasn't grasping really key, you know, core concepts, and
Mm-hmm.
it made it difficult for me to build on that, and instead I kind of shut down and focused more on things that I did enjoy more. And but it's affected me all the way to this day. There are still, and I'm always like, oh, I better go to an ophthalmology lecture, because
Right, right.
because even
Still
now,
weak
and
area.
yeah, well, and that's what's funny is I don't necessarily think for a general practitioner that it is a weak area for me, because
Mm-hmm.
I've done a lot of continuing education, but it's that kind of, like, that pit in my stomach. I'm like,
Mm-hmm.
oh, I better go to ophthalmology. Oh,
Mm-hmm.
this is going to be bad.
Yes.
Which is such a bummer. I wish that there was a way to kind of change that,
You've been, yeah, the
yeah,
trauma is still there.
right, the trauma is still there. And so what are some, strategies or coping mechanisms that people can have, that students can have, if they don't get along with a teacher? Excuse me. Because let's face it, not everybody is going to get along with everybody else. Not everybody is going to be inspired by something that inspires, someone else, which maybe that's a good thing. Maybe that helps us all be a little diverse, and there's somebody in your practice or in your area that loves something that you don't love. So I don't know, maybe
For
that's the
sure.
lesson to take away from it. What do you
Yeah,
think?
absolutely. And as we were, dove in and did a little research to see if I was curious to see if there had been research done in
Mhm.
this area, to see if there had ever been kind of any studies performed to try to figure out what factors into student subjects, and which ones they prefer. And there certainly have been a few studies done. There was one I looked at that was published a few years ago. I believe um, it was a European study. I think it was done in maybe I think it was done in Belgium. They
Mhm.
looked at three things. They looked at students' traits, so kind of like more their personality, and then the cognitive ability, and then the teacher engagement, and tried to kind of piece together how much, which portion of the pie does it take to or which portion weighs into really that subject interest. And it seems from what I could how I could interpret the results was that the student traits and their cognitive abilities really did weigh heavily on what subjects they were drawn to, but that teacher engagement really could tip the scales. So,
Mhm.
um, especially for students who maybe had more of a well-rounded um, you know cognitive abilities, that maybe that teacher engagement might tip them one way or another on, arts or sciences or whatever the case might be. And one of the takeaways from their study was knowing that making sure teachers know that it's not just the subject material, that they really do have an impact on these students, and making that part of the teaching curriculum, as that they need to learn how to increase student engagement, because that really will help with performance and getting the student interested whenever their subject matter is, which I thought was interesting.
Yeah. Yeah, I looked at a couple of studies as well. There was one that I saw. Again, it was European. I think that this was German adolescents. But I thought it was really interesting because it was about, from the student's perspective, about like what makes a good teacher and what makes a bad teacher. And the funny thing was is they didn't the descriptions of a good teacher versus a bad teacher weren't always the opposite, so again, kind of
Mm-hmm.
going back to that, not everybody is going to connect the same way, and that's okay. But what I think needs to happen is that if there is a subject that you feel like you're struggling in, or that you're just not connecting with the teacher or the clinician, the professor on, that you have another way to foster your love of that subject. I saw another study that was talking about the impact of peer review. So instead of getting feedback from the teacher, so if you're looking, for a way to increase your knowledge base and foster your love of that subject, maybe turning to your peers. Thought this was interesting. It's something that they seem to use a little bit more on the human side when training physicians, this peer review feedback. And while they had acknowledged that the peer feedback might not be as accurate as teacher
Mm-hmm.
feedback and grading, it did seem to kind of foster this ability for the students to have more critical thinking skills and then go on their own and come to the right answer and increase their knowledge base that way. So I thought that was interesting too. So just again, kind of looking at all of these angles in order to make sure that uh, if you don't connect with a teacher, that's not going
Mm-hmm.
to affect you for the rest of your 30-40 year career the way it has
Right.
with my ophthalmology.
And it is interesting, too, just the fact that this is something that's being studied. I honestly
Hmm.
didn't realize it was something. I'm not that I consider myself up to speed in the educational research, but I thought that was fascinating. And like I remember growing up, my dad in particular, I'd come home complaining about this, or this, or I'd say I hate Spanish, and I remember, him being like, "Do you hate it, or is it just, just because?" I remember him pointing that out. Like maybe it's
Hmm.
just the teacher you don't like. You don't need to write this off for the rest of your life. So I think even students being aware and kind of taking a moment to recognize that is important too. So
Yeah, that's really good. That's really good advice. I think that's a good place to leave it there today. Dr. Beth, do you have any wins of the week?
I do. I've had a long week. I don't know if you can hear the tiredness in my voice because Paul, everyone, well, has listened more than once, so our mothers, um, knows about Paul, my dachshund, my 10-year-old dachshund, and he had a health scare this week. I'll try to abbreviate the story, but basically he'd kind of been a little bit ADR, and I couldn't figure out what was going on with him. Kept kind of doing an exam on him and not finding anything. And he had just had blood work a few weeks ago. Anyway, I finally found this swelling under his chin, and it was a very firm, big swelling. But like because of his loose, skin there, you couldn't really see it. And it was so firm that I was convinced it was some sort of sarcoma. So I basically had kissed the poor little guy goodbye, because I'm a catastrophist. Assumed the worst. Anyway, took him in the next day. We saw signs of infections. There was a lot of neutrophils and some bacteria on his cytology. So that did give me some bit of optimism, but I still was not convinced that all of this could be infection just because of how firm it was. But he responded really. The win is that he responded really well to Clavamox. He wound up getting. He had some really strong residual swelling that I was afraid was maybe the primary tumor. That went away too. That must have just been like scar tissue or inflammation. He had a dental cleaning with a dentist in the area so she could do full mouth imaging and see if she could find any, obviously tooth root abscess was another differential. Anyway, he currently has a clean bill of health, is back to acting like himself. And anyone who knows me and my codependence on Paul knows that is just the best possible resolution. So that's my long-winded win,
I'm
Dr.
so glad that
Alyssa.
Paul is okay. I'm so glad that Paul is okay.
Oh, but
So.
what's your win? Any wins this week?
Yeah, so I have a win. It is not at all clinical related, although it's a little bit related to today's podcast type, because I'm going to go back to ISU for my 20-year reunion, and I'm going to go see my mentor, and we're going to hang out and probably go sing some karaoke, because that's what we used to do in school all the time. But my win, I don't know if, again, anybody who does listen, Mom, I had mentioned before about my credit card point hacking, and so my win is that like I have all my tickets, I got my tickets and everything, and I was able to get it all with my credit card points, and I was so excited. So I'm not even paying to fly.
I would say that's 2 wins in 1. I love that. Well, excellent, Alyssa. Have fun if we don't talk to you in between then. And to our audience, thanks for joining us, and we will see you all next time.
Thanks for listening to today's episode of Veterinary Breakroom. If you enjoyed today's episode, you can find us wherever you listen to your favorite podcasts, including a video version on YouTube. While you're there, make sure you subscribe, rate, and review. You can also listen to or watch our podcast episodes on our website at cliniciansbrief.com/podcasts. Or drop us a line at podcasts@vetmedics.com. Veterinary Breakroom is a VetMedics production, produced by Alexis Ussery and co-hosted by me, Dr. Alyssa Watson, and Dr. Beth Molleson.